Well, Dr. Klein, thanks for joining me today. I appreciate it.
Thank you for having me.
And we're going to chat about Superior today and also heart failure. And we were just chatting before we went live that you're a heart failure specialist
I am.
at an interventional cardiology show.
Yes.
And we've seen the technology bend that way over the last couple of years, more so than ever before.
Absolutely. I think, heart failure is the only growing epidemic in this country and the Western world. We have more and more heart failure patients, partly because interventional colleagues have been so successful in treating STEMIs and, repairing valves. All these patients are getting older, they're getting more heart failure symptoms. So now we have to figure out how to use technology to improve the heart failure symptoms and prevent hospitalizations, prolong life. So I think this show is really very relevant to us.
And we're seeing a reasonable amount of content directed at that in this show versus let's say over the last 5 to 7 years.
Absolutely. I mean, I remember 2 or 3 years ago, there was maybe 1 or 2 sessions. Now, I personally am involved in 5 sessions, and I'm sure I've seen a lot of my colleagues be involved in others, so there's definitely more heart failure presence.
Yeah. And you're working closely with Shifa Med and part of the Superior platform as well.
Absolutely, which I think it's really interesting because it really tackles the acute problem of heart failure. So a lot of the patients that we see come in the hospital with cardiogenic shock, and a lot of them need support devices. And so far, we really only have 2 types of devices. We have ECMO, which is pretty much a cardiopulmonary bypass at bedside. And we have CentriMag and CardioHelp, for instance, in that platform. And then on the other hand, we only have one continuous flow pump, which is the Impella, the Abiomed Impella. Definitely, we need more innovation in that space.
And with Impella has created that marketplace, obviously. Abiomed has, and has done a great job at that for sure. But when we look at the Superior platforms, with as much as you can share in this conversation, what are the benefits and the features of that may outperform the current standard of care?
It's a great question. I really agree. I think Abiomed has done a fantastic job educating the community about how to recognize shock, how to treat shock early, and why it's so important to treat shock early and support the patient with full support rather than partial support, the way we used to do it, a few years ago with balloon pumps, which are completely inadequate. So having now shifted to we need full support, we need it early. The question is how can you apply that? The Impella 5.5 is a fantastic pump, but we do need a surgeon, we do need an operating room for that, so that limits access and really, frankly, scheduling, because if somebody comes in at 2 a.m., it's impossible to get a surgeon to put in a graft and do an Impella 5.5 at 2 a.m. So partly what Superior is doing is really trying to miniaturize that pump, so provide full support in a format or in a form that's accessible to interventional cardiologists. So you can place a 10 French device and get full support in the cath lab right away. So that will tremendously improve our care, and it will improve really the ability to provide full support right away.
Tell me a bit about your background on how you got into MCS, heart failure, and especially why is the Superior technology important?
Yeah, so I did my training at Northwestern and always loved heart failure. I had a fantastic mentor, Mihai Georgiari, who sadly passed away 10 years ago, but fantastic mentor, and that really got me into heart failure. At the end of my heart failure training, I realized a lot of patients need devices, so I ended up doing an EP fellowship on top of my heart failure fellowship. And I was practicing sort of a combination of EP heart failure for a while. Then I moved down to San Francisco and really started to take on the MCS role as the LVADs were developing and exploding. And then, from durable support, natural transition to partial support to temporary support to get patients to durable support. And that's how I got involved into temporary MCS and get to know the Superior folks.
And the LVAD form factor and platform was the predicate for what we're pursuing right now with Superior.
Exactly. It showed that if you have partial or full support, patients can do better over long term. So then you see improvement in your renal function, in your liver function, in functional ability of patients to do more. So the idea was like, can we get that in a temporary support device to get these patients from really profound cardiogenic shock to improve their function so they can go to either recover, half of the patients can recover, or then to next therapy, be that transplant or LVAD.
And as a heart failure specialist and then an interventional cardiologist, as they both look at the Superior platform, how do you both evaluate that platform potentially?
It's a great question, and I think the interventional cardiologists, right, they're sort of, I don't want to call it attention span, but what they are doing is really measured within an hour or two, right? They need to open up an artery, they need to revascularize a patient, especially patients who have borderline ejection fractions less than 40%, for instance, 2 or 3 vessel disease, great platform for that. Once they're done, their job is done, right? Arteries are open, but the shock is now resolved. So then we deal with the heart failure guys, or the critical care cardiologists are dealing with what happens to the patient for the next 3 or 4 days. That patient still needs full support. Half of the patients actually don't have AMI shock, they have non-AMI shock, so those patients need support as well. So we do need a pump that's reliable and can, get the patient over 72, 96 hours of support, reverse the hemodynamic and metabolic effect that happen in the body, and get that patient out of danger.
And the Superior platform has that capability where current standard does not.
Exactly. So what's Superior are doing on top of what's being offered now, it's miniaturizing the pump, so make it accessible to the interventionist in the cath lab. They can be placed very easily within a few minutes in the cath lab, and then can extend that support for more than 2 or 3 hours as needed for PCI, potentially up to 3 or 4 days, and that's being studied now in their long-term study, so to speak.
Yeah. And then finally, when you look at TCT and you come here as a heart failure specialist, and we're starting to see the trend, what do you expect to see over the next 3 to 5 years as we think about a patient, as they move from maybe a interventional cardiologist up into the heart failure category?
Yeah, it's a great question. And I think it's so exciting because we have now probably 50 different devices being studied in heart failure. It's really a renaissance, if you will, of the field. So what I see in the next 5 years, we have a menu of devices, and it's our job as heart failure cardiologists to try to phenotype these patients and say, okay, this X number of devices will be good for this type of patient, and then work with our interventional cardiologists to be able to use those devices to help those patients.
Yeah, and before I let you go, that you just sparked something that happened on the Innovation Day. The use of AI and the phenotype of that patient. Heart failure is a very complex disease, and it can attack you from many different ways, right? So the use of AI in the phenotyping and potential therapeutic pathway of a patient with broadly heart failure, which has so many nuances to it. What do you see happening there?
I think AI is definitely going to help us. I think we need massive amounts of data and really deep phenotyping in order for AI to be able to develop the models that we hope to develop, right? They need to look at biomarkers, they need to look at imaging, they need to look at functional status, they need to be looking at clinicians' observations. I think the one thing that AI cannot replace is your intuition. It's and that's why I think AI will never replace physicians. Will help us to get faster and better, but will never replace us because we have that human intuition that AI cannot get.
Yeah, and hopefully AI becomes an augmentation and an enhancement, not a replacement.
Exactly.
At least you and I won't be around if that ever happens.
Exactly. That's why we used to think that AI is not artificial intelligence, it's augmented intelligence.
Agreed. Well, I appreciate your time today.
Thanks for having me.
Thank you. I'm Joe Mullings from the floor at TCT 2025, San Francisco. Be well.